Our first guest briefed the Senate early today and will be briefing the House tomorrow on the spread of the coronavirus. We're delighted to have with us tonight Secretary Alex Azar, Secretary of Health and Human Services, and as I said, the head of the President's Corona Task Force. Mr. Secretary, good to have you with us. Let's start with the sudden change in tone on the part of all of the briefing officials in your organization, the CDC, from it's now not a question of whether we will have to deal with this pandemic, but rather when.
Lou, our messaging has been consistent throughout. You know, from day one, we have said that we'll have additional cases here in the United States, but thanks to President Trump's historically aggressive containment efforts, we've actually contained the spread of this virus here in the United States at this point. We now have 14 cases of U.S. identified virus here. These are cases not from bringing people back from Japan or from China, but U.S. cases, 14. We've had 14 for 2 weeks now with no change. So we've got the president's aggressive border control actions. We've got the activation of the finest public health infrastructure in the world, and our hospitals, our doctors, everybody's rowing in the same direction here to keep the American people safe.
No, there's no question that you all, our public health system and agencies have done a terrific job, and we would expect the same of the broad medical healthcare community in this country. But the tone did, I think you would agree, change. It attached greater urgency to it, and if you will, greater certainty about the prospect of having to deal with a pandemic.
Well, what we've said, and what the CDC said today, is there's a progression. And if we see additional cases, as we think we will here in the United States, and if we see community-based transmission, and that doesn't mean nationwide transmission, I think, Lou, you might have mentioned that, really community-based transmission of some variety, we will work aggressively to mitigate the impact of that. And that's really what CDC is talking about.
I was actually not criticizing you.
Oh, no.
In point of fact, I'm complimenting you, because treating Americans like adults is what I expect of our government in every quarter on every issue. And I think that it is wise always for our government to prepare for the worst, hoping for the best. And I think you and all of your folks have all of the talent and the judgment to do just that.
No, I couldn't say it better, Lou. You really phrased it exactly right. We want to treat everybody like adults. The president has insisted on radical transparency. That's what CDC and NIH were doing today, is making sure that the American public know we've aggressively contained this for the moment, but given what's happening in the world, we'll probably see more cases here. We'll probably see community spread of the disease, but we actually have the tools to deal with that. We have been preparing for decades for spread of virus like this. So we know what we're doing. This is what we do. And so I think part of the message to the American people is we all need to take a bit of a deep breath here. The government is working on this. You've got the right people on this. We're working with Congress to ensure we've got the right resourcing, and the president's providing the aggressive leadership on this.
Well, in that regard, let me go through a number of issues that I think would be helpful for our audience, certainly for me, to get an update on. And one is, has there been in any sort of breakthrough with China getting our science, our medical research doctors into China? Is there any sign of greater transparency and willingness to work as a responsible member of the world community?
So we actually have the WHO team, the World Health Organization team, did go to China, and they have now returned 2 scientists from both one from the NIH and one from the CDC were part of that team. And I actually was getting a briefing today, and they did feel they got transparent cooperation and access to data. And the reporting on that will be coming out in the next several days from the World Health Organization. So I actually think that was quite a productive exchange.
Mr. Secretary, in all due respect, I expect our government to report to us. Most Americans do. I don't care about the WHO and its United Nations politics, frankly, or its sensibilities. I want to know what our government knows. And I would really appreciate it if you would acknowledge that that's very important for your department and for this government.
Oh, absolutely it is. It's just the protocol of when the WHO sends a team, that team prepares a report, and then we'll get that report. We'll, of course, debrief the members of our team on that. But there is a report that will come out from the WHO very soon that they're reviewing. But I agree with you, absolutely. We'll get information directly, and when we get it, we're going to transmit it to the American public, being transparent totally as to what we know.
There are some holes that we're contending with, as Ken Cuccinelli, the Deputy Director of DHS, acknowledged. We're having some real issues in terms of dealing with the flow of travelers across our borders, and I'm talking about legal immigrants as well as travelers who are lying to our immigration authorities about where they've been or whether they've been in China. And that creates a real margin for a terrible prospect for the coronavirus, doesn't it?
Well, we've always said we can't hermetically seal the border, and we can't even get 100% enforcement on the border restrictions that we put in place. The whole concept is, can we slow the spread of the disease down, focus our resources, not that some people aren't going to sneak into the country, but rather by these unprecedented measures in terms of border control by the president, slow it down, focus resources, buy ourselves time as we continue to prepare and get ourselves ready.
And finally, is there any contingency plan at which you would suspend travel, international travel?
Well, we're going to always be looking at travel restrictions. We have travel advisors in place. We're assessing them every single day. And as we did with China, we're going to look at if there need to be any appropriate restrictions on people coming into the United States from other countries or who've been in other countries.
So that is
we're always going to look at that.
That is one of your contingency plans, is to shut down that travel if necessary.
We will always look at travel from various hotspots to see if we think restrictions would be effective in terms of the balance of resources. Absolutely. We're going to take any step necessary to protect the American people.
And do you think you're going to get your $2.5 billion that you've asked for communities all the way through to the federal government from Congress and the Senate?
I feel very confident that we'll get the $2.5 billion. And if we need more money, we'll ask for more, and we'll work with Congress on that process.
Secretary, as always, good to have you with us, and we thank you for the briefing.